Live, the news on NBC6 starts now.
The flu season is here, but in this time of COVID, if you get a fever, chills, aches, or sniffles, how do you know whether it's COVID or the flu? United Healthcare's Dr. Maureen Hernandez is here to help us sort out those symptoms. So what's the difference between the flu and the coronavirus?
So there are some similarities, right? So usually the similarities is that it presents pretty much like a typical cold. So both are respiratory infective viruses. They present with fever, chills, runny nose, headache, also some body aches and pains, and overall, some fatigue. So their presentation is very similar. They do have, however, one main unique difference that is actually to the COVID-19, and that's probably the loss of taste and smell that occurs with COVID-19 commonly, and it doesn't with the flu. So that's one major difference.
Now, I know every year doctors advise certain groups to always go get that flu shot. Should more of us go and get the shot because, we're a little bit more, at risk of getting, either COVID or the flu this year?
Yes. So one of the things that I'm an advocate for is vaccinating, especially our children. The flu vaccine is known to prevent influenza, and it's a stronger virus. It has a higher infectivity rate when it comes to our children. So it is recommended with anybody above the age of 6 months or older to get that, especially those with the elderly or greater than 65 years or older should be getting that flu vaccine. Now, one of the things that I advocate about is making sure that you're aware that when you get the vaccine, you also protect yourself at least 7 days after the shot, because your body is very busy making antibodies to that flu. So there are some of the anecdotes of folks saying, oh, well, I got the flu shot and I got sick, right? So there's some of the stigma that you see folks telling you about getting the flu vaccine.
So this year, would you recommend us be more conscientious though? So, sometimes you get the flu, you think, I'll ride it out, I've gotten it before, I'll take some over-the-counter stuff. But this year, should you really, really pay attention?
Yes, yes, and again, I'm definitely an advocate for getting the flu vaccine. It is even the presentation of having exposure to someone who has had the flu or influenza is actually more infectious as far as presenting even the symptoms.
Doctor, thank you so much. Some good information there, and hopefully everybody goes out and get their flu shot. Thanks again.
Thank you.